Hi, everyone. Thanks for joining us for our session today. I just want to start off by saying thank you for joining us, because I know there's been a lot of great sessions on AMR today, and there's been a lot of great sessions throughout the week. So we just appreciate you taking the time to join us. So I am SFAM's Policy and Public Affairs Manager, Lisa Rivera. I'm joined by Lucky Cullen, who is SFAM's Policy and Diversity Officer, and Katrina McDonald, who is currently completing her PhD at the Royal Veterinary College. And up until recently, she interned for us at SFAM. And during her time with us, Katrina and Lucky produced SFAM's case study on the impact of COVID-19 on AMR, which is what we'll be discussing. Just so everyone's aware, this is the first case study of ours in our AMR series. We'll be focusing on different aspects in the series, including the environment, animals, human healthcare, and future technologies. I'll discuss a bit more about that later. So to kick off this discussion, Lucky, could you tell us about your aims for this study and what areas you focused on?
Yes, so we had three main aims for case study one. The first being to provide an overview of how the pandemic is affecting AMR. Secondly, we wanted to inform policymakers on the key emerging issues. And finally, we wanted to ensure that AMR is not overlooked or forgotten about as a focus shifted towards COVID-19. So within this case study, we decided to focus on 6 key areas, which included research, clinical care, policy, public attitudes, environmental AMR, and finally, the future of AMR in light of COVID-19.
So I know you mentioned that one of the key areas for the case study was research. What were some of the findings that you found interesting about this?
Yeah, so the first area we looked at was research. And as the pandemic caused everything to shut down, research into AMR mechanisms, clinical trials, and drug discovery was all disrupted. But even when access to labs was made available again, the social distancing restrictions, shortages of lab equipment have slowed progress. But so to combat this disruption, many researchers pivoted to include COVID-19 in their research. And a survey by Springer Nature suggested that 43% had already or planned to repurpose existing funding for use on COVID-related projects. The way in which funding was rapidly made available for COVID-19 is a great example of how we can use science to address urgent problems. However, in our SFAM annual membership survey, many researchers expressed concerns that COVID-19 will continue to disproportionately attract funding in the future, which could be detrimental to the progress of AMR research.
Yeah, I know it's a shame about this kind of double-edged sword that you're discussing, because it's great to see funding for scientific research area like COVID-19 and vaccinations in general made so readily available and less bureaucracy and everything like that. But then it also, research is losing out just so that one could have, rapid development. And I know this has been particularly severe for medical and clinical research funding, and places like cancer research, for example, have had to readjust their funding projects and projections for the next 5 years. And speaking of which, I know clinical care is an area that's kind of quite obvious for COVID-19 and its effect on AMR. So Katrina, what did you find when you were looking at this across different healthcare settings?
Yeah, so the use of antibiotics in COVID patients has been quite high across healthcare settings. And a sort of literature review of various different publications internationally put sort of this prescription rate for hospitalized COVID patients at around 72%. But the co-infection rate in COVID patients is something more like 7 to 8%, potentially rising to 14% in ICUs. So the rate at which these are being prescribed is much higher than the rate at which people are requiring them, which is obviously quite concerning.
Yeah. You mentioned that overprescription of antibiotics is particularly high in ICUs. Do you know what the main reasons are behind this?
So there's a lot of different factors about this, and it varies between different healthcare settings. And I think at this point, we don't really know what sort of the major factors that have been driving this are. But obviously, early on in the pandemic, it was quite hard to diagnose co-infections with COVID-19. And people were quite concerned about doing aerosol generating procedures to get microbiology samples from these patients. And even when they could, testing was often limited because it was being repurposed for COVID-19 or staff were being seconded. And there's also been problems with overcrowding in hospitals, staff secondment, and disruption of antimicrobial stewardship activities. So 65% of UK pharmacists reported having their routine AMS activities disrupted. So yeah, there's a lot of different pressures that have given rise to this.
Yeah, I mean, I know from the report that we've seen a 6.7% rise in antibiotic prescription in primary care as well, which they've attributed to or linked it to the result of increasing use of telemedicine. I know telemedicine is a big topic right now because, for obvious reasons, there's a lot of merits to it, such as better access for, in particular, disadvantaged groups. But obviously, it can be difficult to diagnose patients over the phone or the computer. I know during the first wave of the pandemic, we found about 50% decline in face-to-face appointments with GPs and practice nurses in the UK. But we do know that telemedicine can work well in some settings. It just depends on having the appropriate antimicrobial stewardship training and guidelines, as previously mentioned. So I think, going forward, we can hopefully become more accustomed and comfortable using this technology, and hopefully that will result in a decrease in antibiotic prescriptions. And I'm pretty sure we've seen a similar picture of this with dentistry.
Yeah, Lisa. So we saw a similar picture in dentistry with a 25% rise in antibiotic prescriptions during the first wave of the pandemic within the UK, which again was attributed to the increased use of telemedicine. Although now we have evidence that the prescription rates are decreasing as face-to-face appointments have been beginning to resume.
Yeah, that's pretty, thank goodness. Were there any other areas of AMR outside of clinical settings that you guys found were affected or disrupted throughout the pandemic?
I think I just about got that. Yeah, so there are a number of different policy areas relating to AMR that have been affected throughout the pandemic. So previously touched upon the 65% of UK pharmacists reported the disruption to the antimicrobial stewardship activities. We've also seen the repurposing of existing drugs, and that was one of the strategies used for the treatment of COVID-19. However, publicity around certain drugs, including azithromycin in combination with hydroxychloroquine, irrespective of the evidence of efficacy in the treatment of COVID-19, led to drug shortages within the USA. So this in turn led to other medications being used in their place, or suboptimal use of antibiotics, which also has a potential to drive AMR. But another area was vaccination programs, and they've been disrupted across the world. So in the UK, we have seen some routine childhood vaccinations which have been missed, but the effects of this disruption will be seen more in developing countries where TB vaccination and diagnosis has been severely impacted, and will pose a real problem going forward. And just finally, we was given a perspective from Professor Laura Piddock, who is the Scientific Director of the Global Antibiotic Research and Development Partnership. And Professor Piddock stated that investment into pandemic and AMR preparedness needs to be seen as a necessary cost for governments, and that access to diagnostics, treatments and research needs to be international, as no one country can solve AMR. It is our collective responsibility.
Yeah, I know a lot of the areas that you've just highlighted, such as like the publicity around drugs and whether or not they're efficient, and also attitudes towards vaccine programs are have a huge impact on the substantial risk that AMR poses. So I'm just wondering if you've noticed any changes in public attitudes and behaviors during the pandemic towards AMR.
Yeah. So I think Dr. Adam Roberts made some of these points earlier on in his presentation today. But I think we can all agree that we've seen a real change in scientific literacy just in the public consciousness because of the COVID-19 pandemic. Words like R number are just sort of in people's vocabulary now. So there is a hope that people will have a greater understanding of how viral infections work and that antibiotics are inappropriate for their use. So this is potentially a really good time to be able to communicate this. And it's also maybe a good time to be able to communicate the problem that AMR could present if it goes unchecked, because now everyone has a real lived experience of a disease that doesn't have any drugs to control it. But people's behaviors have also impacted AMR itself. So obviously we've all been washing our hands more, using hand sanitizers, and restrictions on travel would mean that people haven't been able to transmit antibiotic resistance internationally, or so the patterns that we're seeing in how this is spreading could potentially change as well, based off just how our behaviors have shifted.
Yeah. And it's interesting because, I kind of liken AMR to climate change in the environment in the sense that these are areas that don't receive enough attention and support. And it's really public perceptions and public pressure that kind of drives them. It's kind of the double whammy of AMR in the environment.
Sorry, I think you frozen.
Oh, sorry, I was just asking if you found that the pandemic has affected about public perception and pressure on these two significant areas.
Sorry, I can't really hear you.
Oh dear.
Kat, I think she was asking how has the pandemic affected AMR in the environment?
Yeah, so before COVID-19, AMR was becoming a problem in the environment. So things like antibiotics and biocides, which includes things like hand sanitizers and cleaning products, which have the potential to kill bacteria, can make their way into the environment. And relatively low concentrations of these can cause antimicrobial resistance. So yeah, there is some concern that this will be increasing as a result of the pandemic. And we will need to monitor this going forward to understand fully how it's going to have an impact.
Yeah. Can you hear me first of all?
Yeah, I can hear you.
Sorry. I was just going to add to that. I know one of our contributors, Professor Matt Upton, had published a paper on tools for predicting the impact of increased hospital prescribing of AMR and its effects on environment levels. So, they used a tool that uses nightingale levels based off of metrics such as like NICE guidelines for antibiotic use and prescription rates and patient numbers. And he noted that tools like this one can kind of help us understand how the hospitals are affecting the environment around it. And that way we can better understand where to place them in order to limit damage in the future. But, as you've mentioned, hopefully, like we previously noted with public perceptions in dentistry, we can continue to monitor the environment to better measure the impact and better understand the sources, pathways, and exposure to humans. And I'm going to shamelessly plug that this is an area that we're looking at in our next case study for our AMR series, which is specifically looking at AMR in the environment. And we're aiming to highlight this ahead of COP26 in November. So if anybody watching today would like to contribute to that case study, please do reach out to us at policy@sfam.org.uk, policy homepage on the website. I'm thinking we might have time for one more question. So I'm gonna ask if what you guys have found do you think the future will hold for AMR in light of the COVID-19 pandemic? And maybe we could start with Lucky.
Yeah, so I think I'll leave this down to the experts. So he was given two perspectives on the future of AMR in light of the COVID-19 pandemic, one from Professor Piddock and one from Professor Dame Sally Davies. So if I take Professor Piddock and Kat, you take Dame Sally, yeah? Okay, so Professor Piddock highlighted GARD-P's recommendations for strengthening the response to drug-resistant infections. And these include addressing the silent pandemic of AMR, investing to respond to AMR and new pandemics, global access to diagnostics, treatments and vaccines, expanding global cooperation within a One Health framework, and ensuring that low and middle income countries are equal partners for a collective and fair response.
Yeah, so Dame Sally highlighted that AMR is the first pandemic of the digital age. And we can really learn from this in how we can use data-driven approaches to be able to tackle problems on the scale of these. And also that we need to ensure, obviously, that AMR isn't just overshadowed by COVID-19. This is a point at which we can make progress.
Yeah, both really good points on the stuff that we're seeing right now in terms of vaccine sharing and stuff that we're going to see shortly, if not in the long term. So thank you for that. We're going to be handing over to the WH Peers Prize Award lecture, which ASFAM's president Brendan Gilmore is going to introduce. Before we hand over to Brendan, I want to thank both Lucky and Katrina for producing this case study and sharing their findings today. If you'd like to access the case study, please visit our AMR policy priority section of ASFAM's website. And if you'd like to contribute to the next case study, please email us at policy@asfam.org.uk. And thank you to everyone. We look forward to seeing you at the Peers Prize lecture. Thanks.